welcome to the podcast series Addressing DMD Time to Diagnosis Through Dialogue and Education with Pediatricians. Today we are talking with Dr. Crystal Proud from Children's Hospital of the King's Daughters.
This is Dr. Crystal Proud, and I'd like to review the role of pediatricians in the ongoing care of the Duchenne muscular dystrophy patient. Our primary care clinicians are absolutely integral in providing supportive care and evaluations for our boys with Duchenne muscular dystrophy. In our multidisciplinary clinics, we reinforce the importance of our patients in maintaining regular relationships with their primary care doctors. They need routine vaccine administration, just like any other child. We also encourage them to receive the annual influenza vaccine as well, because they are a high-risk population. In addition, they may have typical childhood illnesses, even though they have perhaps an atypical neuromuscular diagnosis. For example, our patients may still have asthma, and thus they would benefit from routine care of that diagnosis by being evaluated and cared for by their primary doctor. In addition, they're still children, and they're exposed to acute illnesses. They may experience colds, flus, ear infections, and other illnesses that require assessment by a trained clinician in primary care to help manage those illnesses and ensure that they appropriately recover from them. In the event that there is any clinical deterioration, their primary doctor is usually the individual to direct them to an urgent or emergency room for hospitalization and further care. In addition, once there has been identified weakness or concerns for motor dysfunction in a patient who's ultimately diagnosed with Duchenne muscular dystrophy, the primary care physician is critical in ensuring that the patient is receiving the multi-subspecialty care that they need. For Duchenne muscular dystrophy, this includes neurology, pulmonology, cardiology, and perhaps other specialists as needed. Each of the reports from these subspecialists should be sent back to the primary care pediatrician in order to help implement any modifications to their care, as well as keep the pediatrician informed of the progress of the patient. Unfortunately, without disease-modifying therapy, this is a progressive disease, and it will be important for the pediatrician to follow along to ensure that the family is implementing various supports that are necessary as the boy may demonstrate more weakness over time. Last but not least, the primary care physician can serve as an incredibly important support system for families. When the families are concerned, when there is illness, or even just for regular check-ins, the primary care physician serves as a support system that is absolutely something these families rely on. Without the primary care physicians involved, we would not be able to have the comprehensive care for our children that they truly deserve.
Thank you for listening, and make sure you listen to other episodes in the podcast series Addressing DMD Time to Diagnosis Through Dialogue with Education with Pediatricians.